All right, it is 12 o'clock, so we'll get started. Hello, everyone, and welcome to the Healing Community Study Learning Collaborative. My name is Lisa Romley, and I'm the Education Program Coordinator for the HEAL study. We are here today to discuss and learn ways the media can reduce stigma when reporting on addiction. I just need to review some housekeeping items before we get started. Just a reminder that this session is being recorded. And if your screen name is not your full name, you have a partial name or you're using your phone, we ask that you please update and change it to your full name. This helps when we compare the participant list to the registration list. We are offering CE credits for today's session. One CE credit has been approved for physicians, pharmacists, social workers, nurses, and licensed drug and alcohol counselors. And I'll give you some information at the end of the session on how to obtain that CE credit. We ask that you stay on mute during the session, and that helps reduce any echo and extraneous noises. And if you have any questions, and we do welcome your questions in the session, please use either the raise hand feature, which you'll find at the bottom of your screen. You click on reaction and then click on the raised hand icon, or you can type your question into the chat box and we'll read them during the Q&A session. Just to announce that all presenters today have stated they do not have any relevant financial relationships to disclose. And the practice gap that's been identified is journalists, when reporting on addiction, want to get the story correct, but when there is stigmatizing language in reporting, it can negatively affect individuals with substance use disorders, creating barriers to treatment and recovery. And the educational needs that will be addressed is the media coverage of addiction can influence how the public perceives individuals with addiction disorders. Using best practices when reporting can help reduce stigma and promote long-term recovery. Our learning objectives today will discuss and learn the history of addiction coverage by the media and understand the current coverage trends. We'll explain how media has responded to efforts to reduce stigma and discuss best practices with media and addiction reporting. And then the expected outcomes of recognized ways journalists can reduce stigma when reporting on addiction and implement best practices when reporting on addiction. So I am so pleased to welcome our speaker today's session, Krause. Ms. Krause served as a communication director of the National Institute on Drug Abuse at the National Institute of Health for nearly 15 years. During her tenure at NIDA, Ms. Krause has led a media team which resulted in cover stories on addiction for both Time and Newsweek magazine, as well as 2 features for 60 Minutes. As Director of Communication, Ms. Krause launched several innovative initiatives, including the NIDA Med web platform that offers evidence-based tools for clinicians to encourage screening and referral to treatment, and the National Centers of Excellence for Physician Information that partnered with multiple academic medical centers to develop new curriculum. Ms. Krause has been committed to building platforms where teens and teen influencers could get accurate science-based information on drug use. That includes the development of the National Drug Facts Week, which stimulates more than 3,000 teen educational events around the world. She's made major enhancements to the popular website NIDA for Teens and developed and launched NIDA's annual National Drug Fact Chat Day, which is a live chat between teens and NIDA scientists. Ms. Krause began her career as an Emmy Award-winning television journalist covering medical and political issues, and has written a nationally published book on family medical histories, resulting in summary articles for several major national magazines and appearances on Today and Good Morning America show. Having retired from federal service in 2019, she now serves as a senior communication consultant to NIDA. We welcome Ms. Krause.
Thank you for having me. And as Lisa mentioned, I've kind of been on both sides or all sides of the media issue. I was a news reporter, mostly television, for 20 years. And then I switched over to public health outreach. So I then became an advocate in trying to get accurate news coverage. Today, I want to talk to you about a lot of things related to media coverage of addiction because there's a long history. We're going to look at the different roles of media, the historical evolution on addiction coverage, how stigma prevents effective coverage, the importance of framing the message, how people with learned experiences can influence coverage, and just a little bit on pitching to increase interest and reduce stigma. And this applies to people who are advocates pitching to reporters or reporters pitching to editors and publishers. And I want you to note that I'm going to be citing quite a bit of research in this presentation. And so if you receive a copy of the slides, all of the research has hyperlinks if you want to check it out further. Next slide. So the role of news media is something you probably don't think about very much. I didn't when I was a news reporter, but I do recall reading Scott London in 1993, where he said, journalists may take us seriously as news consumers, but generally ignore our wider role as citizens. And certainly that's the case with addiction. So we do know that we rely on the news media for surveillance. We expect the media to cover reports, to cover politicians, to cover events, so we can stay informed. We also do rely on the media, whether we know it or not, to interpret those events, to provide context. You may not realize how much we rely on the media for socialization. And this is how media cultivates the audience's values, beliefs, and norms around societal issues. And one researcher made a reference to TV news, its role as an attention merchant, which means drawing attention to ads. And that might sound a little bit cynical, but it is true, having been in television news for many years, that there is a great interest in having stories that are really going to grab the attention of the viewers. It may not necessarily be all of the things that they need to know, but it is the things that draws their attention. So by emphasizing particular dimensions of an issue, the news media can help shape what issues people view as social problems, can help the audience understand the causes and consequences of those problems, embrace potential solutions, and identify the actors responsible for addressing them. Next slide. So I want to talk for a minute about framing the message, because I didn't think much about this when I was a news reporter in the earlier years. Framing the message is how people develop or reorient a particular concept of an issue. So only some beliefs of a consumer become accessible at any given moment, and it's often the last ones put into memory. And we certainly see that in politics today. Strong frames should not be confused with intellectually or morally superior arguments. For example, if you're covering an addiction issue, you might think something is extremely important for the viewer to know, but in reality, it may not be the thing that they need, that is of most interest to them. So reframing must work on three levels: making new beliefs available, making beliefs applicable or strong or relevant to the reader or viewer, and making certain beliefs more accessible. And that's different than available. Accessible means we need frequency of coverage. You can't just do one story, one and done. That isn't going to penetrate and make a belief more accessible. We need to produce empathy for the topic, particularly with addiction, and we need to use stigma-free language. Next slide. So let's talk about destigmatizing addiction media frames, and this has been researched quite a bit. So there's something called a consequence frame. This is a media message that emphasizes certain consequences of addiction. So if you want to provoke stigma, you'll say addiction results in violent crime. If you want to elicit empathy, you might say addiction leaves behind a generation of parentless kids. Then there's something called individual depiction in a frame. And this is a description of a specific person experiencing addiction. If you want to provoke stigma, you'll tell the story of a violent or criminal activity or an overdose death. If you want to elicit empathy, you'll talk about people engaging in treatment or recovery. And then there's something called a causal frame. Now, this is a media message that directly states or implies the cause of addiction. So if you want to provoke stigma, you talk about it as the result of poor choices. If you want to elicit empathy, you might say addiction is a disease. Next slide. So what does stigma do? Why is it so bad? So addiction in the public health arena If you are provoking stigma, even with public health workers, there will then be less access to health care. Stigma in the clinical arena, there will be fewer referrals to treatment and care. Among policymakers, there'll be less concern about offering resources and funding. And in the general public, you'll wind up with disdain for people struggling with addiction. And we've worked so hard to get rid of that disdain, but it still exists. Next slide. So a little bit on how addiction coverage has changed. Now, here are 3 Time magazine covers, and it really represents some breathtaking change in media attitudes towards addiction. So look at 1997, How We Get Addicted. Look at that sort of monster on the cover. And then in 2007, and this is a cover that I worked with Time magazine on when I was the communications director at NIDA, same topic, how we get addicted, but instead of sort of a frightening evil image, there's a little bit more of almost a cartoon image. But at least sort of the evil nature of the person who's addicted, it has been taken away. And then in 2019, Time did a special issue on the science of addiction, and just look at the breathtaking difference in how addiction is viewed. Now in 2019, it is all about the brain. Next slide. So you even see this in the public health arena. So when I came to NIDA in June 2006, the word abuse was actually mandated. And this was well-intentioned. The policy staff said we had to use the term drug abuse because a lot of people in the scientific community were not taking addiction seriously. It was considered a behavioral problem. It was considered a problem that people caused themselves. It wasn't considered hard, basic science. And so they wanted us to use the term abuse to really underscore how challenging and difficult and serious addiction was. And on the left, you'll see the homepage for NIDA in 2006. And I actually counted and found 7 references to the word abuse, and that doesn't even count the websites that are listed at the bottom. Now, to the right, you'll see the homepage of NIDA recently, and you won't see the word abuse anywhere, except in, of course, our name, the National Institute on Drug Abuse. And what you may not know is we've actually tried to change that name, but it requires an act of Congress, and it's been very difficult to get Congress interested in changing it. But that's a whole nother slide set. Next slide. So what happened to cause this breathtaking change in how addiction is viewed and spoken about? A lot of it started in 2010 at Harvard with a couple of researchers led by John Kelly. And let me just tell you about one of the studies they did. 314 people answered survey questions related to how they felt about 2 people actively using drugs and alcohol. One person was referred to as a substance abuser, and the other was referred to as having a substance use disorder. Overall, respondents felt that the substance abuser was less likely to benefit from treatment, more likely to benefit from punishment, more likely to be socially threatening, more likely to be blamed, and less likely that their problem was the result of an innate dysfunction over which they had no control. And it was believed by simply using the term substance abuser instead of someone with a substance use disorder, it was believed they were more able to control their substance use without help. Next slide. So these studies caused a great deal of discussion in the field. And fast forward to 2017, this is a memo from the White House, and they are announcing a new document called Changing the Language of Addiction, which addressed terminology related to substance use and substance use disorders. And this was telling the entire federally funded public health community that we have to start talking about addiction differently. Next slide. But the real game changer in the media was when the AP style book, who obviously read the White House memo, changed its whole section on addiction and started advising reporters and journalists to talk about addiction differently, giving specific guidelines. Next slide. This AP style book change caused a lot of buzz in the journalism community. You can see up there the web piece from Slate saying, journalists, stop using words like addict and drug abuser. Next slide. So how well did this breathtaking change in how we talk about addiction work. Next slide. Well, in the public health community, it worked really well. On the left, you'll see a fact sheet from SAMHSA, which talks about the power of perceptions and understanding, and this is guidelines for how to use the new language. In the center is a web fact sheet from NIDA, which is addressing clinicians. Words matter, preferred language for talking about addiction. And then even in the private sector, here's something from the Recovery Research Institute called the Addictionary, which also outlines the preferred terminology. So in the public health community, out are terms like abuse, abusers, addict, user, clean, dirty, junkie, etc. And in are terms like substance use disorders and people who use drugs. Next slide. However, in news outlets, the results have been mixed. And while some reporters are really good at using the new terminology, I just recently went on to Fox News, US News and World Report, and the New York Times, and I found prescription drug abuse, drug and substance abuse in titles of their sections and articles. Next slide. So stigmatizing language continues, and there's actually been some research on this. One study analyzed 6,400 news stories about the opioid epidemic from 2008 through 2018, and they did some randomized experiments. They calculated the proportion of news stories mentioning terms shown to be stigmatizing versus less stigmatizing alternatives. And they found that half of the stories on the opioid epidemic still had stigmatizing language, and it was actually up from only 37% in 2008. Next slide. However, stigmatizing news coverage goes way beyond just language. We tend to talk about language because there's been changes to language and new recommendations for language, but we also have to look at the quantity of stories on addiction. Differences in the amount of media attention can influence perceptions of the severity of the opioid epidemic. And there's something called the cultivation theory. So accumulated exposure to TV content can shift people's attitudes towards a worldview. Now that might sound obvious, but then why do well-intentioned reporters and news outlets do one story and think that they've done their addiction story for the year? And we do know that coverage can influence which issues audience think are most important. There was a study done on the Affordable Care Act and in one local geographic area, and they found that the more coverage, the more likely people in that area felt informed about it. So clearly quantity is important, and that plays into stigma. Now, what about the quality of the coverage? This also opens the addiction issue to stigma. So when news outlets fail to discuss health inequity, for example, and the factors that cause it, the public is unlikely to be aware of the disparities or to place a high priority on addressing the factors that drive health inequity. News stories tend to emphasize behavioral explanations for health disparities at the expense of broader social or economic explanations. And this opens the door for stigma. And this has been researched. There's data on this. And research does suggest, though, that media narratives can be harnessed for good. So messages that combine sympathetic depictions of people with substance use disorders with information about societal barriers, this can change views. Next slide. So what about coverage of specific opioid-related topics? In a random sample of 600 news stories from 2013 to 2017, they examined the proportion of news stories mentioning various opioid-related topics. Treatment was mentioned in only 33% of the stories. Harm reduction, 30%. Prevention, 24%, and several evidence-based public health solutions received little news coverage at all. Medications for opioid use disorder, 9%, syringe services programs, 5%, safe consumption sites, 2%. So these findings show that the news media is framing treatment and prevention as the only solutions, but other evidence-based strategies do exist. Next slide. So what about reporting on medications for opioid use disorder specifically? So review of MOUD studies and high circulation news sources from 2007 to 2016, they found that news reporting about the medications increased substantially starting in 2015. 15. So that's the good news. But local news coverage in states with high opioid overdose rates highlighted more negative than positive consequences of MOUD. And 36% of news stories about the opioid crisis that included a depiction of a person receiving substance use treatment. That's good, I guess, but fewer than 1% depicted a person receiving medications. So fewer than 40% of news stories about MOUD mentioned that these medications are underused. So underuse has not been framed as a problem. Next slide. So let's take a look at some geographic disparities. Look at drugmap.org. Now, this is a multi-stream news archive platform that was developed by researchers that captures news media data. And they looked at the number of opioid-related news reports, 2017 to 2018, and they found 92,124, and that does not include duplicates. However, the opioid crisis receives greater media attention in more urban and educated areas, the Northeast, for example. Opioid-related deaths, though, are more common in communities that are exposed to less news about addiction, less educated, have a greater proportion of whites, less diverse, and are more rural. The relative lack of news discussion in these areas means less awareness, less interest, and less investment in opioid-related issues. So it is critical that news reporting on opioids is distributed equitably and accurately to prevent misperceptions and stigma. Next slide. So how can the news media reduce stigma? So there's limited research on this, but here's what we have. You can use narratives that combine sympathetic depictions of people with messages about societal barriers to treatment, such as provider shortages. You can cover people who've undergone successful treatment and are in recovery. You can attribute responsibility to factors outside of a person's control, like neurobiology, lack of treatment access, or an injury resulting in treatment with prescribed opioids. You can highlight positive traits such as perseverance and determination in the face of adversity and successful recovery. And some researchers suggest that reporters could receive training and education on stigma-producing approaches. And in one individualized story I wanted to mention that's been mentioned in research, a pregnant woman with opioid use disorder described external barriers to treatment, such as a long waiting list for methadone treatment. The researchers found this actually increased audiences' feelings of sympathy compared to a control arm where the external barriers were not mentioned. And I want to point out, this isn't just the role of the news media to reduce stigma, it's also the role of the people who are approaching the news media and pitching stories or presenting ideas to the news media or keeping the news media informed. It's very important also to consider what we've learned from this limited research. Next slide. And I want to, for just a minute, mention individual contact-based programs. This is not a household word, but let me explain it. So in 2016, the National Academy of Sciences did a report funded by HHS called Ending Discrimination Against People with Mental and Substance Use Disorders, the Evidence for Stigma Change. This report did not mention much about the media, but it recommended educational campaigns. It recommended evidence-based peer programs, but it also recommended what's called contact-based programs, which facilitate interactions between people with lived experience and the community. Now, this, of course, is assuming the community welcomes this disclosure. Many of them do, some don't. Next slide. So this gets us to people with lived experiences. And in the Healing Communities study, those of us who've worked on this are very familiar with this because one of our campaigns really focused on the experiences of people in treatment and how they overcame some of the barriers to treatment. But it was my experience, either as a journalist or as an advocate for addiction, journalists always want a personal local example. And here are some examples of that from the Cleveland.com, which Cleveland Plain Dealer, where these brave souls came forward to talk about their experiences. Next slide. So in pitching, whether you're pitching to an editor, pitching to yourself to decide if you should cover a story, or you're an advocate pitching to the news media. This was an interesting statistic I came across. A 2004 study found that the most common source of local TV health reporters' ideas for stories was personal contact from a public relations professional, and that includes an advocate for a public health organization. That was more common than a press release, communication from a viewer, or a national wire service. So it's very important that you take an active role in pitching, but it's very important to stay away from scientific jargon, which is a challenge when you're part of a scientific study. It's very important to keep the pitch simple. What is the one thing you want to communicate? And when you communicate that one thing, think of stigma-free framing. It's also extremely important to be ready with local and regional angles if you're pitching to local media. Have local statistics ready. Have local people with learned experiences ready, and have local experts ready. And if you're lucky, you'll get some that are media trained or good with the media. And to the right, you'll see a chart. That chart is actually showing statistics from a specific county in Ohio that made it into an op-ed on Cleveland.com, Plain Dealer. And I'll bet you anything, had they not had those local statistics, it never would have made it into the op-ed. So when you're pitching, it's important to send a follow-up email after a couple of days. Ask if they've had a chance to review your concern. So you want to send it out to more publications if they're not interested. And you might get completely ignored, but either way, use that follow-up connection and continue it, not in an obnoxious way, but occasionally, because it's important to build a relationship with a reporter, editor, or producer, so they know where to go when it's time for them to do a story on addiction. Next slide. And this is my final slide, and this is extremely important for whether you're a reporter or an advocate. Pay attention to what's going on in local news in your community and find opportunities to flip negative stories to stories of hope. And here's two examples of negative stories. And I'm not saying negative stories should not be covered. It's important for communities to know what's going on with drug trafficking in their area. But here's a story from the Detroit Free Press: people with addiction more likely to get COVID-19 and die. Very important story. But there's a reporter's name right there. There's nothing to stop you from calling that reporter and saying, would you like to know what we're doing to try to help people who have addiction in our community? And the same with this article on a drug raid from Washington, D.C., Channel 7 News. There's nothing to stop you from calling that reporter who is named in the article and saying, would you like to know what we're doing to try to help people who become addicted? So anything you can do to flip a negative story to a story of hope. When a story becomes hot in a community, even if it's a series of overdoses or a teen that has lost his life due to overdose, there is nothing to stop you from calling that reporter and saying there is hope. And that's the final message that I wanted to leave with you today. And then this last slide, I just want to prove to you that I really was once a television reporter, and I thought I would treat you to some 80s hair. That's from Channel 2 News, CBS in Chicago. Anybody have any questions?
Thank you, Carol. We will take questions at the end during our
Okay.
Q&A session, but
Okay.
so thank you very much. That was great. We are now going to move towards the conversation about content creation. And for this session, we have Taylor Six, who is a reporter for the Richmond Register in Madison County, who has written a number of articles about the drug epidemic, addiction treatment, and recovery. Ms. Six has worked directly with programs such as Madison County Harm Reduction, Spark Ministries, and the UK Healing Community Study. We also have Abigail Broughton. She is employed as part of our HEAL team, serving as a prevention specialist, in which she provides overdose education and naloxone distribution for the Madison County community. In addition, she has also volunteers facilitating self-help groups for individuals with substance use disorders and conducts community outreach to the homeless population. And our moderator for today's session is Nikki Lewis, who's assistant professor in the Department of Communication at the University of Kentucky. Her research centers on social psychological processing and the effects of mass media. She has published over 20 research articles in outlets such as Mass Communication and Society, Health Communication, and Journal of Media Psychology. I'll now turn it over to Nikki.
Thanks, Lisa. Hi, everyone. Good afternoon. So what I wanted to do is kind of kick off this conversation between Taylor and Abby in discussing the article that Taylor wrote for the Richmond Register in October of 2021. Taylor, let's talk first about how the article came to you and that content creation process, and then how you forged a relationship with Abby kind of at the very beginning.
Okay, great. Yeah, so thank you all who organized this learning collaborative, first of all. But in terms of getting this article together and the content creation, I am the government reporter here at the Register. So I cover Berea City Council as well as Richmond City Commission. And Abby had actually gone in front of the Berea City Council at one of the meetings I was covering, and she spoke about the Healing Community Study and the collaborative effort. And she had actually been at the Spoonbread Festival in Berea, speaking on the community studies behalf. So I had reached out to Laura Nagel, who is part of the harm reduction team at the health department here in Madison County. She works directly with Abby. And as was stated, I had been doing several articles about recovery and addiction and substance use disorders. So I had reached back out to her, Laura, to kind of continue that conversation and see what we could do in terms of the next steps to kind of keep that conversation going. And she actually had suggested to reach back out to Abby. And so she connected us via email, and we just began talking. And from there, we kind of set up interviews so I could talk with her, get her story, learn what she did specifically with the Healing Communication Study. And from there, we just kind of talked and went over everything that we thought would be important to include in the story. And that story really focuses on, what she went through, as well as the Healing Community Study, what she does with the program now, and how that study has actually been implemented in other areas in Madison County, such as the jail, the harm reduction team, and what exactly it does to help those affected by substance use disorder or who are going through active recovery here in Madison County. So that's kind of a brief synopsis of how that story came to fruition and my connection with Abby.
Yeah, so a lot of work on the ground floor in the community and making connections and, working with your folks at your job and also in the community. Abby, for you, what was it like to share so much personal information with a news reporter and to kind of divulge some personal stories and put yourself out there for the good of the public and to inform people more about substance use?
Thanks, Nikki, and thank you, Taylor. So it was a very interesting, and it was a bit challenging. I had several questions, and I somewhat was on you could compare it to a teeter-totter of, do I do it, or should I do it, should I not do it? And I will say, just a couple of days prior to Taylor contacting Laura Nagel, I had previously been at an outreach event with Laura in which she had completely witnessed someone comment a very, very straightforward and negative phrase regarding their own son, whom had recently overdosed in like the past year. I sat there with no comment. It was actually Laura who mentioned, would you believe the lady sitting here right beside me that she is 7 years in long-term recovery from the exact substance that you're speaking of your own son who passed away. And she's here today providing naloxone training. So that is kind of what spurred, I guess, or motivated the story and the push to speak on my personal story, and also to advocate for evidence-based practices from HEAL, proving that, naloxone overdose education and naloxone distribution does save lives, and it does give people an opportunity to enter treatment. Although it was nerve-wracking, and I personally, even to this day, I knew prior to the article, many people locally in my community knew that I'm a person in long-term recovery. However, when something gets shared, in a newspaper article and it's just out there more so, people tend to, I guess, revisit, again, like they remember, that's right, she is in recovery. So I will say again, I think the stigma that still exists of just simply, even if you are a person in long-term recovery, there's still that stigma. And I'm thankful that I was able to work with Taylor, and we were able to collaborate on especially certain pieces of language to change that and reiterate that positive reinforcement, person first, and just to recognize that substance use disorder does not discriminate, and it's possible for anyone. And it certainly does not mean that you are a bad person or have, it's a moral failing of any sort. And I'm just beyond grateful that Taylor was willing to work with me and evaluate those sources that I was able to go back through and locate on our own HEAL website, thanks to a combination of people on HEAL coming from our treatment providers, the addiction specialists, the pharmacy team, prevention team, communications team, everyone. I can't list all of you, but tremendous kudos to you.
Thanks for sharing, Abby. Taylor, I want to ask you, what did you learn working on this piece about stigmatizing language and stigma? Carol just gave a great keynote about best practices, leading with empathy, sharing success stories. The way that you wrote this article, really championed that approach. What lessons can you kind of share with the group as far as what you learned writing this?
Sure. So in terms of writing, initially I'd reached out to Laura to kind of get some more ideas of different ways we could go about still addressing the same issue of be it recovery, addiction, what services Madison County has to offer for both of those. And when I got in touch with Abby, it was kind of like I don't want to say home run, but for the story's purpose, she had a story that could speak on addiction. She had a story that could speak on long-term recovery, and also with the healing community study that was really making a big impact at that time. So it was all in all like, this is going to be great. She can take me through all of these aspects. So that being said, after our correspondence continued and I did finish writing the story that included her and all of her amazing story, which I was very thankful for her to share with me. And typically journalists never do this, but because it's so personal and because she took such a great leap of faith, I had spoken with my editor and I was like, look, I really want her to be comfortable with this. And I really want her to be okay with us putting this out into the community. So I sent back the first draft of the story to her, which was also beneficial because she was, crucial in those other aspects as well of the healing community study and things of that nature. So originally it was sent back to A, make sure she was comfortable, and B, to make sure that the information with the study was correct and that everything she thought should be included with that was, to make it a better article for the community to understand. And what I learned after she sent back some edits, there were a few, personal notes that she had wanted to change, but a lot highlighted several terms that I had used that were negative, stigmatizing language that was not necessarily written out of malice or any kind of reason like of negative impact. But as Abby and I discussed last night over the phone, it was just something that kind of had been ingrained in our language and the terms we had been using throughout journalism, throughout conversation, and just any kind of terms of talking about recovery and addiction. So she highlighted some of those and emailed me back and was like, hey, here's what you can do as a replacement of those, which are way more destigmatizing and really help others see this in a different light. So that was super beneficial to me. And she actually sent me this amazing graphic. I think it's the dictionary that had so many terms and what you could say in replacement in more of a positive light. And I could not have been more thankful for that, because it really just made so much sense. And as I said, it's kind of been ingrained in our brains to say things like substance abuse, substance abuser, clean, dirty. So it just made me think it's one little way throughout all of these articles or any of these articles that I can, even if people don't necessarily realize it as they're reading it, it's just one way to kind of get that positive reinforcement in there over and over. And so maybe, unconsciously in their mind, they'll start to pick up on that, just as we have with the destigmatizing or the stigmatizing language that we have previously known for years and years and years. So like I said, it was really at first more so to make sure the information was accurate and that she was comfortable. And not only did Abby do that, but she also really helped me to kind of figure out better ways to still get the message across and to do it in a way more positive light, which has actually helped me shed light to my other coworkers of, wow, this is actually really, really cool and a really great way to reframe everything that we've known so far in terms of addiction and recovery language.
Yeah, that's and the whole workplace dynamic as well, kind of shifting as well as kind of a new practice, a new best practice. Abby, I want to toss it over to you one more time and kind of speak specifically about coming from Richmond, an admittedly smaller community comparatively maybe to larger cities. Where did you experience stigma that was maybe unexpected? I know we've talked about the recovery community itself. You are so brave for putting yourself out there. What are some things that maybe you experienced and how you overcame them once the article came out and there was more visibility to your story?
Not to necessarily like pinpoint certain groups or highlight certain, names of places or whatnot, but I will say that I think just over time, years and years of conditioning across from the local recovery community, our healthcare system, like healthcare professionals, the criminal justice system. I think it's just kind of been like a continued cycle that we recognize ourselves as, a past addict, or that I should say that I'm clean and that I'm clean now and this or that and sober and whatnot. And yes, all of those things can be said, and I don't personally take any offense to however someone wants to identify me as. However, I will say that on a larger scale, I am, okay, 7 years in long-term recovery. And for those whom are also in long-term recovery or early recovery, whatever it may be, don't you feel as though you deserve respect and some integrity? And just as the person standing right beside you, only because I'm a person with a past opioid use disorder, um, that I should be labeled as this or that. I believe I deserve just as enough or just the same amount of respect and dignity, and to be recognized as a stable employee for the last 7 years, a tax-paying citizen, a law-abiding citizen. I do my very best to be the best mother to my 3-year-old that I possibly can be. I try to be present for my family. I try to be active and an advocate for those who currently are not in the position to speak up for themselves, because I know, speaking personally, 7 years ago, I did not have, there was not the support, the amount of support and networking that there are today, or that there is today, for people seeking recovery, and especially the variety of evidence-based recovery routes, pathways. There was not any of that. And looking back, even from trying to seek meaningful employment and such, and furthering my education, there were so many days and occasions that I would meet with persons in an authority like figure, and somehow what might possibly come about that they knew that I was a person in recovery, and that in itself would result in a negative end to whatever it may be that I was trying to pursue at that moment. And let's just say I had several doors shut. However, I'm beyond grateful for where I'm at today and the opportunities that lie ahead. That those doors were shut, because it gave me the perseverance to continue on. And again, Nikki, I continue to ramble, but just saying that is why I'm such an advocate for people in recovery, seeing that no, it's not about us trying to take away however you want to self-identify. It's for the greater good, for all people to receive a chance at having respect and dignity.
Thank you so much, Abby. It's so crucial to hear your story. And Taylor, I want to thank you as well for sharing your process. Lisa has posted your article in the chat for folks on the LC to visit that story, that great story about Abby. I want to thank you again. Lisa, let's open it up to the roundtable with our media professionals to talk a little bit more about practices.
Great. Let me introduce Jennifer Reynolds. She's the manager of Health Communication Marketing and Media Program at Oak Ridge Associated Universities. She has over 15 years experience managing health communication and social marketing projects. Jennifer currently supports the Kentucky Healing Community Study in design, development, and implementation of evidence-based campaigns addressing stigma, opioid overdose education, and naloxone distribution, medications for opioid use disorder, and opioid treatment retention. In 2019, Jennifer collaborated with the University of Kentucky Institute for Rural Journalism to design and present a workshop for journalists on ethical reporting on the opioid crisis. We also have Alex Acquisto, who is a journalist with the Lexington Herald Leader, where she reports on public health and social services. A Western Kentucky native, Alex studied history and literature at the Western Kentucky University in Bowling Green and creative nonfiction at Salt Institute for Documentary Studies in Maine. She previously covered politics and social services for Bangor Daily News before moving back to Kentucky in 2019. And we also have Johnny Curry, who is the Senior Marketing Promotion Specialist with our HEAL team. Previously, he was employed with the USA Today Network, where he partnered with physicians, clinics, hospital networks throughout Tennessee and Kentucky, using market research to help them tell their story. So we welcome Jennifer, Alex, and Johnny to the roundtable discussion.
Yeah, so Alex, I'm actually going to start with you. Can you share some specific examples of dealing with sensitive content in media production based on your work experience?
Sure. I think I want to start by saying to sort of reiterate some points that Carol made in her presentation. For journalists right now, and I imagine that any journalist covering substance use disorder or the opioid epidemic has had this thought internally, realizing that there is a tremendous sort of decades worth of systemic stigma that exists in society. And so it's our job as journalists to factor that in when we're reporting on this issue, to understand how language has changed and to understand that the layperson might not have the understanding of a topic that we have. So how do we report on not just the devastation of the drug epidemic, but how do we provoke empathy in our reporting too, which is something that I strive to do whenever I write about this topic. I guess firstly, I was looking back at some of my clips that I've written for the Herald Leader since I came here in 2019. One of the basic things that I strive to do anytime I write about this is to explicitly mention addiction as a disease in any story that I write. We all have to write the stories. I imagine anybody who covered the drug epidemic wrote a story this past year about the historic spike in overdose deaths nationwide and here in Kentucky. And so we all have to write stories like that, which is obviously the most heinous thing that can happen. And is the sort of very dark side of addiction. I try and strive to balance my reporting by reporting as much as I can on people. And I've reported on people who are in active addiction trying to get out. I've reported on people who are in active recovery and sort of tried to convey what that process is like. So, and I've also made mistakes too. So one of the first stories that I wrote when I came to the Herald Leader was about this small program in Berea called Harvesting Hope, where a long-term recovery center that I spent quite a bit of time in for women basically provided an educational farming program at this sort of backyard farm in Berea, and they got what's kind of comparable to work credit through that, so that when they left this recovery program, they could more easily find gainful employment. Anybody who understands this population well understands that they face marginalization for a number of reasons, and that recovery happens in community, which has everything to do with who you surround yourself with, and also employment and housing. So I wrote about that program, not just that the program exists, but I really tried to convey what the people were like who were participating in the program. The ages of people range from 25 to 60. Many of the women had entered recovery programs before, gotten out, remained in recovery, and relapsed. Many people understand that to be a process of recovery. And so even sort of presenting that as this happened, but it doesn't detract from the overall effort of wanting to remain in recovery, which is a lifetime choice and sort of, it's a decision that you have to make on a daily, sometimes hourly basis, in my experience. And another story that I wrote back at the beginning of the pandemic, sort of thinking about how addiction happens or recovery happens in community, how the sort of statewide lockdown affected people who rely on meetings, that sort of recovery effort, how that affected them. It's I kept hearing from people that addiction is a disease of isolation. There's nothing worse than being stuck in your house during a COVID pandemic, not being able to meet with your recovery group. How do you cope with that? So I really tried to key in on the human part of that too. And I've also written about how we got to this point. In Kentucky, we know that one of the things that fueled our opioid epidemic is the sort of negligent and excessive prescribing of prescription opioids that like largely contributed to our problem. And so how are physicians adjusting their behavior to reduce that going forward? So I followed a doctor around in an Eastern Kentucky hospital in, I think, 2020, showing what those changes looked like in real time, how they were actively trying to prescribe fewer opioids and how that played out in their conversations with patients. And then something that I've reported that I've actually would have done differently in hindsight is the communities and the people in recovery that I have spoken with, part of, in my experience, reaching the recovery level stage is about ownership over how you got there. The recovery population are some of the most self-actualized people I've ever met in my life. And I've sat through many recovery meetings and am really constantly in awe of what it actually takes to get to that point. And so separately, how do I incorporate that into my reporting is something that's important to me. But there are phrases and ways that they refer to themselves. Countless times I have been around people who are in recovery who refer to themselves as addicts. In a way, it's them taking ownership over their life and the choices that they have made. I understand that my use of addict as a journalist is different. And so how do I, even people I have quoted in my hospital story, I quoted a top official at UK Healthcare using the word addict and included it in my story, and actually later included it in the headline. That's something that I would have done differently in hindsight, even though he was a healthcare professional, even though he understood the stigma too. It's different, it's like a weird appropriation of that word. It has different ramifications when I broadcast it from my pedestal as a journalist. And so I think constantly being aware of how would a person in recovery read my story, how would they feel represented by it? And did it basically pass muster in the way that I want to represent what is a very complicated issue? Long-winded way of answering your question.
No, super great answer. Thank you, Alex. The idea of kind of approaching this from multiple angles is fascinating. And the realization that you as a journalist have a different role and maybe need to tweak your language in different ways than even those involved in the recovery or healthcare communities is crucial information. And so speaking about using that language appropriately, Jennifer, I want to ask you, based on your experience, what's the best process for creating content that not only manages stereotypes and stereotypical language, but is content that is appropriate for marginalized individuals so that they feel included and not stigmatized from the coverage itself?
Yeah, terrific, important question. I think a great starting place, obviously, is to include marginalized voices in your content development, right? If we start from a place where we are inclusive and guided by those voices from the very beginning, already we are showing a value in what they have to say toward their own success, right? So I think that's one, but to Alex's point, self-stigma and stigmatizing language within those in remission and recovery is common. So, Carol and I worked through this regularly when we were doing our video campaign for HEAL. We would have clips that people self-described themselves using stigmatizing language. So during the video process, we would do some coaching about why we would prefer different terms and explaining sort of the impacts of that. So there was an education and sort of an exchange there of information that occurred. We've also sort of sent back quotes with things that have said, hey, one of our key values as an organization is that we aren't using these languages, and here's why. Do you mind if we take out this word and replace it with that? And no one to date has declined to have their quote once we sort of did that. Let's see. In terms of marginalized, I think having a style guide for yourself is a really great resource. And there are some excellent ones out there. Obviously, AP for my reporters, NIDA has their words matter terms to use and avoid when addiction. The dictionary is great. The addiction language guide from Shatterproof is wonderful. Reporting on addiction also has style guides, and I'm happy to send out those links to these groups. Those are great things to just sort of have on your wall to do as a quick check as you're writing, to make sure to catch yourself, because language is a learned behavior. Let's see what else I have in terms of making language accessible and these stories accessible to marginalized populations. One thing I've learned recently, so we're doing right now a study for CDC on communications best practices for persons experiencing homelessness. And one really interesting thing to me is the need to make sure that when we are making health recommendations and stories, we also include the information that everyone needs to be able to take those recommendations. So I think we often just assume that we put the name of the treatment center in there, that we all can pull out our phones, type it in and instantly get a Google map to go there. Well, differences in access to bandwidth and internet exist. So any opportunity that we can provide a website, a phone number, directions with landmarks that provide some sort of descriptive awareness to where these locations are in these stories so that access is more equitable is a good start.
Thanks so much, Jennifer. You've offered some concrete tools that can be used, and I want to mine Johnny's experience working for USA Today and targeting media audiences. What specific strategies, Johnny, can media outlets like local newspapers do to get the word out about, addiction resources, or even just story and news coverage? Can you share some of those strategies that might be most effective?
Yes, absolutely. And it kind of is wonderful to me to hear, Carol's, to see Carol's presentation and to hear Taylor and Abby's story and Alex and then Jennifer, and then it kind of brings it really full circle for that question. Working in local media, there's always been a separation between church and state with the newsroom and advertising. And one thing that I think could really bode well to promoting those resources is to kind of bridge that gap. Whenever there's a story being written, over the epidemic, let your advertising team know, hey, if there's any local partners in the area that you are working with that are nonprofit, that we can, promote and have, kind of a promotional statement within this article. Also have them, reach out to, any of the, just to use a hyper local example of Fayette County, to the Bluegrass Care Navigators, or the recovery cafes, or to be able to take their story and implement it inside the story of Deviate Kitchen. When they're running a story on them who are a second chance restaurant that operates for employing those who need a second chance. So to really be able to bridge that gap between the journalist and the advertising room, that would really go a long way to be able to promote those resources. Also to give those stories more reach, once you're partnering with the local recovery centers and organizations, If it's a print, say we're speaking to local newspaper, also run that same thing on your own operating news site to give it more bandwidth, to give it more reach, to reach that audience that might only be your digital subscribers. Now they're able to see the story that would have normally only ran in print. Be it an op-ed or be it a branded content piece that that organization to put together. Also give it that digital stretch as kind of added value to that story to help get more eyes on it.
Thanks for sharing that. And this could be a question for all three of you. In your experience, what have you found has captured the most attention, either from persons with lived experience or people facing a substance use disorder? I'll throw it out to the group. Anybody who's interested in sharing those stories.
Just speaking personally, the stories that I tend to get the most response on, and not even necessarily ones that are most read, but the ones that I hear from people directly the most, are the ones where I write very personally about people who have struggled with addiction at some point in their lives. I think it's always important to remember, I'd like to think that we are well past, because I sort of cavort with people who understand addiction the same way. Addiction is a disease. It is not the result of necessarily choices that you make. People who live in active addiction do not want to necessarily be in active addiction. And so I understand that, and I forget that not everybody does. And I think that sometimes helping people who read my content just remember that everybody is susceptible to this. It affects people across socioeconomic statuses. It is a disease in the same way diabetes is a disease. And so understanding this population to be people, even though very basic, I think really resonates sometimes with readers of, they read about this harvest recovery story that I wrote, Harvesting Hope, and read about this woman named Rhonda, who's in her 40s, who reminds them of her mom. She is in active recovery, and her plight is just as sincere as all of the other women that she's in this recovery program with. And so I think creating these extremely personal stories, because addiction is a complicated issue, those are the ones that I tend to hear the most reader response on.
Yeah, that's a helpful response because, Carol presented some of the literature and research on this. Attention grabbing language is often negative, and our negativity bias binds to negative information. So negative headlines, negative information tends to grab our attention first, but this personalization component seems to be crucial in finding ourselves in the stories in doing that. So any other insights from the group on thinking about how to do that regularly while still, Alex, I'm going to assume that you have pressure for clicks and pressure to get visibility to your stories. I'll open it up again for any other thoughts in that kind of capacity.
Well, first, just to commend Alex on her emphasis of disease in her reporting. When you mentioned that's not dead, and in some of my notes, I was referring to a July 2021 study that was a survey on social stigma, and they found that the strongest factor associated with stigma was the belief that OUD is a medical condition. So those that did not believe that OUD was a medical condition had higher stigma, endorsed that OUD was a crime, and disagreed with policies to support improving access. So as we think about our messaging, to continue to push that not only is OUD a disease, but it is one that can be treated with the support and breaking down all these structural barriers. So I love all of the stories that you've discussed. Absolutely.
Yeah, and I don't know if you all saw, there was an op-ed that came out recently, I believe in the New York Times, that is pushing back against the addiction is a disease narrative. What as we're pushing towards reframing addiction and substance use disorder, are there any strategies that can be used to offset some of the pushback against changing those language, or the refusal to embrace a new approach? Is it about just creating more content and pushing it in more spaces with the right language, or is it just accepted that it's going to be a slow and gradual change into more scientifically correct and destigmatizing approaches to content creation? Any thoughts there?
Nikki, I know I'm not on this panel, but I wanted
Join us, Carol.
wanted to make a reference to, there are 2 or 3 psychiatrists who have made a living off of the addiction is not a disease theme. And to this day, I'm old enough that I see them emerge every 2 or 3 years, getting a very high profile op-ed in some paper somewhere, because their approach is so bombastic and, oh, what, and then they know that it'll get readers. And it's the same 2 or 3 people every time. They do have psychiatric credentials, but it drives me crazy that these well-known news outlets are still giving them a voice when there is nothing new in what they have to say. It's semantics on what is a disease and what isn't a disease, what's a compulsive behavior, what isn't, what is a choice, what isn't. And every time this happens, we would have to get our own op-ed together with our director and the director of the Alcohol Institute, and yet again do another commentary in JAMA or some big journal fighting back. So I just want to point out, when you do see this isn't a change or a trend. It's just the same people who have made a living off of this. So I just wanted to point that out, and be careful when you hear it. It's fine to talk to them, but make sure that you have, other people giving other points of view in whatever article there is.
It reminds me a lot of the journalistic notion or the norm to provide both sides of the story, right? So with big controversial issues like climate change, the consensus is out. 98% of climate scientists says that the climate is changing, but we still see practices where they show the 1, 2, 3, 4 people that have very loud voices. And it's about, like you said, being prepared to respond and being prepared to kind of, have an approach to responding to that type of content. So I want to pause our roundtable and go ahead and bring everybody back that was so kind to offer their time to join this wonderful learning collaborative today, and open it up to our nearly 100 participants for Q&A. You can feel free to drop a question in the chat, or you can actually unmute yourself and ask. To open up the questions, though, I actually want to revisit the chat. Ellen put in a question for Taylor. Could you ever have the opportunity to write or present to your fellow media persons about learning to write in a non-stigmatized way? Your enlightenment story is interesting.
Sure. I would love to kind of have that opportunity to do something like that. Really, this is the first opportunity I have had and or been invited to kind of speak on that. And really, it's something that I've just learned myself through the cooperation of my editor, like I said, of reaching out and kind of saying, hey, I want to make sure that they're comfortable with this. But it certainly would be a great question, not only for all news media outlets, but for the Richmond Register specifically, to maybe take the initiative as a media outlet group and speak with other areas locally in terms of outlets, media outlets, the colleges, any kind of journalism majors or things there, to say, hey, this is what we've done differently. This is why it matters. If you are thinking of going into this, this is going to be something you are always probably going to be reporting on in the near future. So that actually would be a great initiative for me to talk with the people at my office about doing in our community, and kind of taking that step, because like I said, this is the first opportunity I've had to kind of discuss. But I would really be more than happy to kind of push that out there here locally.
Thanks, Taylor.
Thank you.
Any questions from our attendees? We must have stunned them into silence, you all. We did so well. I will ask a question of Carol. Carol, you know, obviously your experience and your 80s hair, as was mentioned in the chat, was wonderful. But I also want to get your perspective on, you know, a lot of folks in the room are practicing media professionals or interested working in the media if they're journalism students. What are some challenges as you've kind of straddled both the government side and the media side? You know, the government obviously operates under different norms and practices. How best can journalists navigate getting information from government resources, or can you speak to just your general experience of the true differences in working in more of the media field or as an industry professional versus working as part of a government organization?
Well, I should say when I was in grad school, I got a master's in communications and public affairs. I took a course called How to Lie with Statistics. And the whole bias of the professor was the government will throw statistics at you to subvert the truth. So it was very interesting. And so it was a story on how to help interpret statistics. So it was very interesting to sort of then switch over to government life, which is a whole different story. But I think a lot of people don't realize with science that there isn't the government and everybody else. The government funds a tremendous amount of science in private institutions. And you can easily go to people, the professors and the scientists who wrote journal articles, and go to them directly and get information if you're uncomfortable with having to fight the battle of going through an agency of some kind to get information. You certainly can look on agency websites. Some of them have great websites with a lot of information. But if you want to follow up with someone in the private sector, there's, you know, every state has terrific universities. Every single state has universities that gets government funding, but it's unrestricted funding, and the government is not allowed to tell the scientists how to write their papers. And so, and I have found that generally to be true, because sometimes we would have grantees that wrote papers we weren't happy with. So I know that that's generally true. So that would be one recommendation. But also in the public health field, it's a field that's very mission driven. Everybody I know in government and public health really wants to do the right thing. I mean, when you get up to the level of political appointees, it may not be true, but when you're dealing with old-fashioned bureaucrats, which I was at the you know, sort of mid-level of government, they really do want to do the right thing, and they really are driven. It may not be the case with some of the political appointees, and different administrations have different approaches to trying to control what those agencies say. But the bureaucracy has done a terrific job of just keeping the ball rolling through various administrations. I worked for 4 of them. They all had different approaches. But I would work on trying to get backup and sort of verification from scientists in the private sector if you're uncomfortable with something you're hearing from the government. I think that would be very important. However, it's also very important to notice that some people in the private sector have been in science for 40 years, and they may not have the freshest approach either. So try to look around and find young, new, vibrant voices in the field. That would be one of my recommendations. I really relied on people in government when I was a news reporter to help me with a lot of statistics. So I don't have, because I did a lot of health reporting, that's how I ended up going into public health. So I don't have the cynicism that a lot of people have about government. You know, if I was writing about something like immigration or commerce or some other things, I might be a little more cynical about what the government's putting out, but because there's so much politics entwined with that. But in public health, I think that you can be a real partner with people in the government. And if you're uncomfortable, get it backed up by someone in the private sector.
That's very, very good advice, Carol. And I think it interestingly connects to Abby's story of, the willingness potentially in that sector, the public health sector, to maybe make connections that wouldn't normally be expected. Abby, can you speak to how the Healing Community Study, the approach, the information, the collaboration has maybe helped you be more comfortable sharing your story, or how has HCS supported you, or how have, we know your contributions to the HCS can't be quantified, but has that been a good connection for you and helped support you in sharing your story?
Yes. Oh my goodness. As I had noted earlier, if it were not for Hill, I know I would have another job, or I may still be where I previously was. Who knows? But I do know, and I can completely say that Hill has given me, has helped me find my inner voice. Like, I knew I'd always had it, and I had shared it in certain circumstances previously. However, I feel that the Hill team has truly become the largest support network that I could ever dream of. And every person on this team, not only, across the Kentucky site, but at a higher level, just everyone encourages me. Every article I read, I'm constantly trying to learn, and I just find it so intriguing, everything about Hill and what we are doing. And I just, as I always say, I'm beyond grateful that it's here now, and I can be a part of trying to help people down the road, because I did not have this type of help or resources available, or I wasn't aware of it. Let's say that.
Yeah.
So.
Thanks, Abby. That's a super positive note to kind of end on. And I do want to encourage one more time, if anybody has questions, to drop them in the chat, and we'll be sure to follow up with resources post session. But I'll toss it over to Lisa to wrap for us. And I want to thank everybody again for taking the time to join us today.
Thank you, Nikki. I just wanted to review some of the continuing education credits and reminders for getting your CE. But also, before I start that, I also want to remind the group that post-session, what I do is develop a collaboration space in Teams. And this provides an opportunity for resources to be posted and information, and you can have discussion and respond to different posts. So it's a great way to get together and discuss various topics. So you will be included on that when you signed up and registered that you wanted to be part of this team. And with that, I think we'll be posting Taylor 6 article. Also, Jennifer Reynolds mentioned a number of NIDA resources, so we'll include those. And of course, the slides from Carol. So they'll be up there on that team website. So, all right, so if you are wanting CE credits, we ask that you go to this link here. I am going to put it in the chat.